welcome to Pharmacy Notes. Today we are going to talk about therapeutic drug monitoring of phenytoin. Phenytoin is an anticonvulsant medication used to treat seizures in patients with epilepsy. However, it has a narrow therapeutic range, meaning that too much or too little of medication can be harmful to the patients. That's why it's important to monitor the levels of phenytoin in the patient's bloodstream. As we already know that a therapeutic drug monitoring is a process of measuring drug levels in the patient's bloodstream to ensure that they are receiving the appropriate dose of the medication. And therapeutic drug monitoring is done for the drugs that have a narrow therapeutic range like phenytoin. So now we will discuss the pharmacokinetic profile of the phenytoin. First of all, we will discuss absorption. Phenytoin is well absorbed after oral administration, so mostly it is given through the oral route. Then if we talk about its distribution, it is mainly 80 to 90% plasma protein bound, and its volume of distribution is 0.65 liter per kg. And when we talk about its metabolism, it is mainly metabolized by liver, and elimination, it is excreted in urine as in glucuronide conjugate. Now let's have a look at the therapeutic range of the drug. So the therapeutic range of phenytoin is 10 to 20 microgram per ml. So the dose should not exceed 10 to 20 microgram, or it should not fall below that dose, because the toxicities of the phenytoin in the body are related to the dose. So if it is below the therapeutic range, it can cause toxicities, and if it is above the therapeutic range, it can of course cause toxicities. So what are the toxicities that are caused by the phenytoin? We will discuss this. As I said, these are dose related. So if the dose is between 20 to 30 microgram per ml, it could result in nystagmus. And similarly, if the dose is above 30 to 40 microgram per ml, it can result in ataxia. And if it exceeds 40 mcg, 40 micrograms per ml, so it can cause mental changes in the patient. So it is very much important to maintain the therapeutic range, and it should not exceed the therapeutic range. And when talking about drug interactions, if phenytoin is given with anti-epileptic drugs, they will ultimately rise its level in the body. So the drug concentration of phenytoin in serum will rise. And similarly, if it is given with azoles, it will also lead to increased phenytoin levels in the body. And if drug is given with sulfonylamides, it also increases the serum level of phenytoin in the body. Now let's have a look at the monitoring parameters that are necessary while giving the phenytoin to patient. So first of all, we should monitor the phenytoin levels in the body. We have discussed earlier that its level should not rise above the therapeutic range. It can lead into different toxicities, and with that, RFT's renal function test should be monitored, as it is mainly excreted through urine. And in addition to that, we should also monitor the clinical effects produced by it and response of the medication. We should observe that whether the drug is producing the positive response or not, and albumin levels should also be monitored. And in addition to that, cardiac monitoring with IV administration. If it is given through IV route, then cardiac monitoring is also necessary. Then another thing that we have to examine is the mental changes and neurologic status of the patient, because as we already said that if it exceeds 40 mcg, it could cause mental changes. So during therapy, it is necessary to monitor all these parameters. Then at the end, we will be talking about the sampling time. So if the drug is given orally, so after 6 hours, we should sample the drug in the body, or we should check the levels of phenytoin in the body after 6 hours. And if it is given through IV route, then the sampling should be done after 4 to 6 hours of the dose. So I hope everything was clear in this, and it will help you a lot. So wait for the next video, which will be related to any other drug for which TDM is necessary. Till that, goodbye.